everyone. So today we'll be going over careers in medicine, which which stems off of our previous presentation. So today we'll be discussing the different careers in the healthcare field besides being a doctor. So today we'll cover, as I mentioned, we're going to be covering a physician, which is a doctor. Then we'll be covering a physician assistant, and then we'll also be covering nurses. So, what is a physician? A physician is a person who practices medicine in order to restore patients' health. So, if you have the flu or another sickness, you would go to see a doctor. That doctor is a physician. So, a physician and doctor, they're both synonyms, so they essentially mean the same thing. So let's go over the job description of a physician. They work at a hospital, they assess patients, they diagnose illnesses after examination, they treat a variety of conditions and prescribe medicine, they order and perform tests to help patients recover from illnesses. So let's look at the types of physicians. In the healthcare field, there are several types of physicians, and here are just three examples of them, even though there's so many more. So one of them is a dermatologist, and a dermatologist is a doctor who specializes in treating patients with skin abnormalities. These include burn patients, patients with acne, and patients with eczema, just to name a few. So for example, if you had a pimple and it's really bothering you, you would go to see a dermatologist and they can help treat it by prescribing medicine. Yeah. Next is a pediatrician. A pediatrician is a doctor who specializes in treating children from when they are born until they turn 18 years old. They treat minor problems to major diseases. So if you're under the age of 18 years old, you are seeing a pediatrician for your annual checkups. Finally, we'll go over what a cardiologist is. So a cardiologist is a doctor who specializes in treating patients with heart abnormalities and illnesses related to the circulatory system. So in one of our previous videos, we went over what the circulatory system is. Whenever there's a problem with that system, you would go to see a cardiologist, which will help treat that. So now we'll go over what a physician assistant is. Physician assistants hold licenses and are able to provide direct patient care under the supervision of a physician. So let's go over their job description. They work at a hospital, they assess patients, they diagnose and treat common illnesses. So they do not specialize in specific illnesses such as, like as I mentioned before, like how dermatologists specialize in skincare and how cardiologists specialize in problems related to the circulatory system. Physician assistants just focus on broad common illnesses. They work with minor procedures, and the most important part is they work under the supervision of a physician. So if a physician isn't there, the physician assistant cannot perform their job. So let's look at the differences between a physician assistant and a physician, because their job descriptions are pretty similar. This Venn diagram will help you guys understand the differences. So let's go over the physician assistant first. They're supervised by the physician. They focus on primary care, which I mentioned before is like not a type of specialty like dermatology or cardiology. It's basically family medicine. And their overall salary, their average salary is around $86,000. Now let's compare that to a physician. A physician can open up their own practice. They have to supervise the physician assistant. A physician can practice in specialized care, such as cardiology and dermatology, and their average salary is $166,000. So now let's see what both of them have in common. They both provide quality health care to people, and they're able to interact with patients on a daily basis. So now we'll go over what a nurse is. A nurse is a person who is trained to care and assist patients at the hospital. So they're basically like the assistant for the doctor or the physician. So the job description, they work at a hospital, they conduct physical exams, such as taking your pulse and taking your temperature when you're about to see the doctor. They offer advice and emotional support to patients, and they help doctors diagnose the patients. So once again, they're kind of like the doctor's assistants, and they work directly with the doctors. Overall, I hope this presentation helped you guys understand the different the different careers in the healthcare field. A physician or doctor isn't the only option. There are many other careers, such as the physician assistant that we went over, and a nurse. So yeah, thank you for listening.